You know, if you or someone you care about has ever had a lung cancer screening, you understand just how important those results are. But here's something you might not know. The rulebook doctors use to interpret those scans just got a really big upgrade. So today, we're going to decode the 2022 changes that are making this life-saving tool even smarter and safer. So why all this focus on a rulebook? It's because this type of screening is an absolute game changer. I mean, a massive study proved that it cuts deaths from lung cancer by at least 20%. And that's not just a statistic. That represents thousands and thousands of lives saved. It's a huge deal. But there's a flip side. These CT scans are so incredibly powerful that they see everything. Every little spot, every shadow, every tiny cyst. And this creates a major challenge for doctors. How do you figure out what's a real threat and what's just, harmless background noise? That is the million-dollar question, right? And the answer lies in this standardized system called Lung-RADS. Think of it as the official guide for radiologists. And this brand new version is all about being more accurate and, frankly, less stressful for patients. So let's break down the 4 biggest changes. All right, first up, the new rulebook is way better at helping doctors zero in on some suspicious shapes that might have been overlooked before. We're talking specifically about certain kinds of cysts and some nodules found near the airways. Okay, so take a look here. On the left, you've got your basic thin-walled cysts. Totally fine, not a cause for concern. But then look over on the right. See how those cysts have thicker walls? Anything over 2 millimeters, and the 2022 update says, whoa, we need to pay closer attention to this. And this table really spells it out. If you have a thin-walled cyst, you're good. Just continue with your annual screening. But if it's a thick-walled one, or one with multiple chambers, that now gets classified as Category 4A. That basically means this is suspicious, and it automatically triggers a follow-up scan in 3 months. It gives doctors a really clear, simple roadmap. And here's another one they're flagging now, a multilocular cyst. You see those little internal walls that divide it up into different sections? Well, the data shows that these have a slightly higher chance of being something serious, so the new rules give them their own specific follow-up plan, just to make sure nothing gets missed. Okay, on to our second big update. And this is just as important as finding the bad stuff. It's getting better at confidently ignoring the good stuff. This is all about reducing those stressful, false alarms for patients. The truth is, these scans find a whole lot of stuff. Old scars from infections, harmless lymph nodes. The hardest part is having the confidence to tell a patient, yeah, we found something, but we're sure it's nothing to worry about. These new rules help provide that confidence. Now, check out these little spots right here. They have a fancy name, Juxtapleural nodules, just because they're located right up against the lining of the lung. Doctors always knew some of these were probably fine, but new research has really expanded that rule, and that's a huge deal. So here's the key takeaway. The rule is now much clearer. If one of these nodules is touching the lung lining, it's solid, it's smooth, it's oval-shaped, and it's under 10 millimeters. Doctors can now confidently call it benign. Just this one change alone is going to prevent a ton of unnecessary follow-up scans and all the anxiety that goes with them. The new rules also have a really smart way to handle something that looks like it could just be a temporary infection. Instead of jumping to conclusions, doctors can now just recommend a short-term follow-up in about 1 to 3 months. It's a practical solution to make sure it clears up on its own, and it avoids a whole lot of needless worry. So we've talked about what to look for and what to ignore. But what about when something changes? Well, our third big update gives us a crystal clear, black and white definition for one really important word: growth. And there it is. Growth is now officially defined as an increase of more than 1.5 millimeters in a nodule's average size over a 1-year period. It sounds super specific, right? Well, that's the whole point. It completely removes the guesswork. And this is so important because it creates consistency. It means a radiologist in one state and a radiologist in another are using the exact same data-driven measurement to decide if a nodule is really changing. It takes the subjectivity out of it and just makes the entire screening program that much more reliable. All right, last but not least, our fourth update. This one is all about the patient's journey after a scan finds something suspicious. The old system for follow-ups could be, well, a little confusing. The new rules make things a lot more logical. So get this. The old system had this weird paradox where a more suspicious nodule that wasn't growing might get a checkup in 9 months, while a less suspicious one got checked in 6. It just didn't really make sense. So to fix that, the 2022 update introduces this brilliant new system. It's called stepped management. And it's basically a clear, logical pathway that de-escalates the follow-up plan as a nodule proves that it isn't a threat.
So here's how this new logic works. Let's say you have a suspicious category 4A finding. You get a scan in 3 months. If it's stable, no growth, you don't just stop. You step down to category 3, which is probably benign, and then you get a 6-month scan. If it's still stable, you step down again and just go back to your normal yearly screening. See? It's a logical progression that builds confidence with every step.
So when you put it all together, what does this actually mean for you, the patient? It means higher accuracy. It means fewer scary false alarms and unnecessary tests. It means less anxiety. And it means you get a follow-up plan that's clearer and more logical. It's all about giving you more confidence in your results. And you know, at the end of the day, that's what this is all about. The real goal of screening isn't just to find cancer, it's to provide clarity. And with every single update like this one, that picture gets a little bit sharper for everyone involved.